Hi, we're Diabetes Consciousness. Welcome to our YouTube channel. Today, we delve into a significant and relevant topic: chemotherapy as a treatment for neuropathy. If you have ever had experience with the symptoms of neuropathy, you know how unbearable these symptoms can be. It takes courage and determination to seek and apply solutions to chronic health problems like this. While science and medicine together seek to address complex health situations such as this, let's review the different aspects to keep in mind when using chemotherapy to treat neuropathic pain. So, without further ado, let's get started. 1. Neuropathy. Let's start by remembering that neuropathy is a disease that affects the peripheral nervous system and can cause characteristic symptoms such as pain, muscle weakness, numbness, and tingling in different body parts that can become very intense. Neuropathy appears due to damage in the blood microvessels, which causes injury to the primary sensory nerves due to a lack of neuronal oxygenation and nutrient deficiency when the cause is diabetes, nerve lesions of other origins, or even chemotherapy as a side effect of cancer treatment. 2. What is chemotherapy, and why is its application in neuropathy? Chemotherapy is a therapy that uses drugs to attack cells at different stages of their cell cycle. By understanding how these drugs work, physicians can predict which combinations of drugs are most likely to have the desired effect on cells, in this case, neurons. Chemotherapy is cancer treatment, but in some specific cases, it is being used to treat neuropathy. The origins of chemotherapy to treat neuropathy come from scientific studies and clinical observations that found improvement in neuropathy symptoms in patients receiving chemotherapy treatments for cancer. This finding led to further research to understand how and why chemotherapy can have an impact on neuropathy. This treatment in neuropathy is based on evidence that some of the low-dose chemotherapeutic drugs help reduce nerve inflammation by improving nerve function. These drugs are identified as potentially beneficial due to their anti-inflammatory and neuroprotective properties. On the other hand, they interfere with nerve cell function by decreasing pain transmission. Although these drugs, when used in the treatment of cancer, can cause temporary peripheral neuropathy as a side effect, they are used in lower doses to treat the neuropathy as such. 3. Types of chemotherapy in neuropathy. Oxaliplatin. This is a chemotherapy drug used to treat colorectal cancer. Paclitaxel. It is a chemotherapy drug to treat several types of cancer, such as breast, lung, and ovarian cancer. Vincristine. This is another chemotherapy drug used to treat several types of cancer, including leukemia and lymphoma. Cisplatin. This is a chemotherapy drug used primarily to treat lung, testicular, ovarian, and bladder cancer. All of them, within the side effects for the treatment of cancer, can produce temporary peripheral neuropathy, as we said before. However, for the specific treatment of patients with peripheral neuropathy due to other origins, the doses of the drugs are lower than for cancer treatment. The modulation and combination of doses of chemotherapy is the practical result for neuropathy. 4. Modes of application. These drugs are administered orally or through intravenous infusions according to each patient's specific needs. It is essential to highlight that the choice of the mode of application of chemotherapy will depend on the degree of complication of the neuropathy, as well as the individual sensitivity of the patient. Before learning about other essential considerations on chemotherapy in neuropathy, we invite you to subscribe to our channel and give us a like to continue fulfilling our mission. If you want to learn about other diabetes-related topics, visit our blog, where you will find issues that provide valuable information. The link is below in the video description. Let us know your questions in the comments and we'll reply. Okay, let's move on. It is important to note that the choice of chemotherapy drug for the treatment of neuropathy will depend on several factors, such as the type and severity of neuropathy, as well as the underlying disease that may be present. Each case is unique and should be evaluated individually by a neuropathy physician to determine the appropriate approach. In addition, it is critical to remember that these medications may have side effects and should be administered under the supervision of a healthcare professional. Additional considerations. It is critical to work closely with the medical team to develop a treatment plan tailored to each patient's needs. Lean on the medical team to monitor and minimize side reactions to the medication. keeping in mind that chemotherapy as a treatment for neuropathy can also generate undesirable side effects such as nausea, hair loss, and fatigue. With medical support and proper treatment, people with neuropathy can improve their quality of life and find relief from symptoms. Effectiveness of treatment. The effectiveness of chemotherapy as a treatment for neuropathy can vary depending on the case and severity of symptoms. In most patients, after chemotherapy, symptoms improve. However, the results may be less satisfactory in other cases, and symptoms may persist. Suppose you would like to learn more about this topic. In that case, we invite you to continue exploring our channel, where we address different aspects of neuropathy and its treatment. Conclusions. The advantages of chemotherapy in treating neuropathy are that it can help reduce inflammation and relieve pain associated with neuropathy by stopping the growth of damaged nerve cells. It contributes to improving nerve function and quality of life for patients. It is essential to keep in mind that treatment for neuropathy with chemotherapy should be studied and individualized by the specialist physician, since each person responds differently to the chemotherapy drugs chosen. Chemotherapy has significant side effects and can be toxic to the body. Therefore, its use in treating diabetic neuropathy should only be considered in exceptional cases and under the supervision of a physician specializing in neuropathy. Thus, chemotherapy may be an effective option for the treatment of neuropathy in specific cases, not being a first-choice treatment. It is necessary to keep in mind that research in this field is still ongoing, and more studies are in progress to better understand the mechanisms of action and effectiveness of chemotherapy in treating neuropathy. Work is underway for more effective treatments with fewer side effects in the future. If you are dealing with neuropathy, remember that there are other treatment options available before using chemotherapy. 1. Analgesic and nonsteroidal anti-inflammatory drugs, NSAIDs, opioids, tricyclic antidepressants, and anticonvulsants. 2. Physical therapy that helps to improve muscle strength, coordination, and mobility. 3. Strengthening and stretching exercises are beneficial in maintaining nerve function and reducing stiffness and pain. 4. Occupational therapy includes pain management techniques and adaptations of devices to facilitate daily activities. 5. Transcutaneous electrical stimulation, TENS, uses electrodes placed on the skin to send mild electrical currents to relieve pain. 6. Lifestyle changes. Maintaining a healthy diet, exercising regularly, quitting smoking, and limiting alcohol consumption can help control neuropathy symptoms and improve overall health. 7. Control the underlying disease. If neuropathy is caused by an underlying illness, such as diabetes or the herpes virus, controlling and treating that disease can help prevent further nerve damage. Stay hopeful and seek the proper support to improve your quality of life. Don't forget to like us and subscribe to our YouTube channel to see more informative content on diabetes education. And visit our blog. We leave you the link below. Please leave us your comments, questions, or suggestions below. See you soon!